Welcome, everyone. This is Mayor Steve Haggerty, and you are joining the Coronavirus Q&A today on March 4th, 2021. As always, we have this audio taped, and it's actually live on channel 16, live on Facebook. We will play this episode for the next week or so on channel 16 for anyone that is not watching live. If you are watching live, please go ahead and put any questions that you have into the comment bar, and Patrick Degnan, our Chief Communications Officer, will be monitoring that. I started off wearing my mask today because I don't want people to forget, even though we're in the phase of vaccinations right now, and we'll talk a lot about that today and where we stand here in Evanston and what our frustrations are potentially with getting our hands on more vaccine, which is my frustration right now. And I know many of yours as well. Even with the vaccinations, we have to remember to continue to wear our masks, to continue to social distance, to continue to avoid large groups of people. We can almost see the light at the end of the tunnel, and it's several months away. But there are different variants out there that public health experts and medical doctors are concerned about and monitoring closely. So we're getting close to a finish line, and we don't want to extend that and push that back even further by dropping our vigilance. And I mention that because here in Evanston, as everyone knows, based on comparative data, whether it's the positivity rate, whether it's the cases per 100,000, as a community, we've done a great job since almost a year ago now. March 15th was the date that I declared the local state of emergency, and today's March 4th. So we're almost at a year point. We've done a really good job as a community. There really has been a whole of community response and recovery effort. I'm so proud of Evanston. But I will tell you, even though our numbers on an absolute basis are still pretty low here for Evanston, our positivity rate is actually, for really the first time, higher than the county average, higher than the city of Chicago, and higher than the state average. It's a little over 4% positivity rate, which is still, again, very, very good. But something's going on. And so I just wanted to take a minute and share with you our most recent statistics. Yesterday, we had 9 new cases in Evanston. Altogether, we have 3,953. So we're almost getting close to that 4,000 mark of folks here in Evanston that have had COVID-19. We have had a few deaths since the last time we got together. We've had 112 deaths and fatalities due to COVID-19. There has been, just as an aside, the floral project that's a nationwide project and that we brought here to Evanston. One of our former residents brought it to us, and our hospitals and university and others are participating in it. And you may see it was on March 1st, but there still may be around a few floral heart wreaths that are around. And it's just one more way to remember those that have passed, and another way for people to grieve the passing of so many people. And our 7-day moving average for cases is 14. Now that is influenced by a fact that we had 40 the other day, and that 40 was driven by some past data that hadn't been reported, and that was captured there. So I think if you probably took that out, we're probably more like 8 cases or so a day. But there have been a couple outbreaks here in the community. Most of the cases tend to be younger people right now. So we're talking high school age, college age. So just a reminder to any teenagers that are watching, any adults like myself and others who have teenagers, just to remind folks that, again, the public health protocols of masking, social distancing, staying away from large groups of people, it makes a difference and it keeps our numbers down. So let's get right to the questions. We have 2 guests today who are familiar to many people. Ike Ogbo, our public health director, is with us, and Greg Olson, who's our operations chief and Ike's deputy in the Evanston Public Health Department. Lots of questions, fellas, as you'd imagine, related to vaccine supplies. I mentioned at the top, I'm a little frustrated that we're not seeing an increase in quantities of supplies. I've been telling people, based on information we've been getting from Illinois Department of Public Health, and from what we're all seeing in the news, that quantities are increasing, and yet the increase that we have here in Evanston is pretty negligible right now in terms of first doses. Let's get right to the vaccine questions. Greg, I'm going to start with you first. This is a question from William. And we have a lot of questions again today, lots on people's minds. So let's try and rapid fire get through these quickly. Is Evanston using vaccines up as quickly as we receive them?
That's a topic that Ike and I have talked about since the very beginning, is that when we get our vaccine supplies, we want to use them right away. We don't want to be sitting on any supplies, especially first dose supplies. So as soon as we get them, we put a registration link together, we put our pod together, and we get the link out to individuals. The only time where we would have vaccine on hand that we wouldn't be able to use yet would be second doses that we received from the state, and we're waiting for that time to come up for those second doses. But other than that, first doses, when we get them, we use them right away.
Yeah. So, William, I asked this question a lot. Other people in the Emergency Operations Center are asking, and we are not sitting on any large, quantity of vaccines. As soon as we get them, we're trying to get them in the arms of folks. Ike, I'm going to go with the next question to you, which is a question lots of folks have. And this is from Patricia. Why is Evanston only holding a few events each week to vaccinate residents? Why aren't we holding more?
Mm-hmm. Absolutely. As Greg indicated, we schedule events when we receive the first doses. The second doses are a little different, where we hold on to them until there's time for us to schedule a second dose event. But we can only hold events when we receive these vaccines. We're not holding on to our first doses, vaccines. So as soon as those doses come to us, we are scheduling events. And I'll give an example. We have an event scheduled for Friday. We didn't get those vaccines until Wednesday. So we immediately sent out a link to qualifying individuals for that particular event. So even though we're holding these few events, the few events that we are holding is enough for us to definitely administer those vaccines that have been shipped to us. And we also have the capacity to vaccinate more people if we receive the vaccine. So the issue here is the shipment of vaccines that we are receiving. We are not receiving significant amounts at this time.
All right, so we still don't know exactly when and how much vaccine we will receive until we get it. And once we receive that, then we set up a point of distribution event. I'm going to, Patricia, I want you to know that it's not like we have 10,000 doses of vaccine and they're saying, oh, let's just do 2 events this week, 3 events next week. If we had 10,000 doses of vaccine, we would be holding events every single day long. We'd be giving vaccines to our hospital partners, our healthcare institutions, and all of that. So I'm just going to come out and I know we've been asked by higher authorities not to give specific amounts that we receive each week, but generally in the past we have been receiving 300 to 1,400 doses a week is sort of what the range has been, and the projection for the first 3 months of 3 weeks of March is in the high hundreds to 1,400. Again, we are not seeing significant movement. So I'm just going to say this right up front. My strong recommendation to folks is register at different locations. If you are in phase 1B and eligible for a shot, register with your pharmacies, register with your healthcare providers. Although, again, healthcare providers here at least don't have much vaccine because they are reliant upon the health departments to give them vaccines, and we aren't getting that much, as I just went through the numbers. And so we're holding these pods. We did have a question that just came in on Facebook, Ike, from Greg asking, how many first doses do we have? And I know that fluctuates. I mean, do we generally have on hand? And let's just say, how long do you usually have them before they're in somebody's arm?
So the first doses that we have on hand, and as you indicated, Mayor, it has ranged from 300 to 400. We don't keep first doses for a long period of time. And as I mentioned, as soon as we get these doses, we are administering them. We are scheduling, as I mentioned, an event for tomorrow, and the doses that we received for this week are going to be used for that event. So we're not holding on to doses. We are administering them as soon as we get them. We're just being optimistic and hopeful that our weekly allotments will increase week by week, but it has not significantly increased at all. So we're just being optimistic at this point.
Okay. All right. So back to the point I was just raising. If you register with your healthcare providers, even if they're struggling right now to get, vaccines themselves, I am pushing our state legislators, talking to IDPH and others, to make direct allocations to Amita St. Francis, Erie Health, to North Shore University Health System. These are trusted healthcare providers. Register for the event at the United Center in Chicago. That is a federal vaccination facility. It's not just for Chicago residents. So while it's inefficient, and it would be much more efficient if we had the vaccines to get them here, register for that event. Linda asked this of you, Ike. Are Evanston and Illinois getting a fair allotment of vaccines?
Yeah, I can speak to Evanston, and the answer is no. And that's why we have been pleading our case to the state to increase our allotments. We do have the capacity to administer thousands of vaccines a day, only if we get the vaccines. So going back to my answer, it is no. But we are being optimistic that in these upcoming weeks that there will be a significant increase, and we're ready to administer those vaccines when they reach us.
Again, just so everybody understands, vaccines are going from the federal government to the state governments, and then the state governments are allocating them. So we're not in a position where we can go and get our direct allocation, so to speak, from the federal government or from these pharmaceutical companies directly. I will say I am, I'll tell you what I think is going on. What's going on is, again, they're setting up these mass vaccination sites, okay, where thousands of people are getting vaccinated. You're seeing that on TV, not just in Illinois, but across the country. So the United Center would be a recent one. And again, these are good. There's going to be, hundreds of people working there, but it does mean that people come from a much larger geographic area to those locations. What's frustrating to me is that we are not first off using our existing healthcare infrastructure. And what that means is it means that, the city of Evanston's health department, North Shore University Health System, Amita, are either idle or underutilized. The capacity in this city is, I believe, and correct me if I'm wrong, Ike, between our healthcare partners in the city, we could probably do 12 to 15,000 vaccinations a week. And correct me if I'm wrong, if we had, the supply of vaccines. And I am, pleading and speaking with our state elected officials, folks in the governor's office, IDPH, about that. Again, the approach that's being taken, though, by the state right now is larger mass vac centers, as they're called, mass vaccination centers. And that's why I am encouraging our residents to, submit, registrations and contact forms at all of these different outlets. So that if we're not getting, the supply that we need here in Evanston, we can try to get our folks and all of us vaccinated through these other mass vac sites. Lynn asked, when do we anticipate vaccine supplies will increase? Lynn, I expected they were going to increase in March because that's what we had been told. Again, we're seeing a pretty insignificant increase in first doses. So those numbers that I ran through before, which is, over the next 3 weeks, we're looking at, 900 to 1,400 a week. Our first doses. We are, and I think the state's doing a good job, we are getting doses for once you've gotten your first shot to get that second dose. People are probably familiar that Johnson & Johnson just had their vaccine approved this week. That is rolling out across the country. When I did speak to a representative for the governor's office and IDPH just 2 days ago, they were optimistic that that's going to increase the supply. Of course, I said, well, does that mean Evanston then is going to see some more of this increased supply? I think we have to wait and see. But the Johnson & Johnson vaccine is one shot. And so that makes it more efficient for all of us. So that's a good thing. So we should see supplies increase there. But I can't give you a good guess of when we're going to see the supply increase here in Evanston. Daniel and Ann asked a question. Greg, I'll throw this over to you. Will the city receive Johnson & Johnson vaccine doses? If so, will residents have the option of choosing which vaccine they receive?
Yeah, eventually we will be receiving the Johnson & Johnson vaccine. We're at a point right now where we cannot order vaccines. We're in a position where the state tells us what vaccine we're receiving and how much of it we're receiving. So they will be distributing it out to the other jurisdictions. As far as residents having a choice between choosing which vaccine they get, again, right now we're not at a point where we can be, pick and choose which vaccine we want. So if you become eligible for a vaccine, whichever one is available, it's highly recommended and suggested that you take the first available vaccine.
Great. And Alexandria had a question. Which vaccines has Evanston been distributing thus far? Pfizer and or Moderna? Greg.
So at our Evanston pods, we've been distributing the Moderna vaccine. We've only gotten a small allocation of Pfizer, which we have initially sent over to the 2 hospital systems. And I think the state realizes that local health departments prefer Moderna vaccine just because it's a little bit user-friendly logistically wise. However, that has the storage specs of Pfizer has changed recently. They can be held at a normal freezer for up to 2 weeks, so that makes things a little bit easier for us. So I would expect our increase of Pfizer vaccine to go up in the next coming weeks as well.
Wonderful. And just for folks out there, in case you're talking to neighbors or residents that have gotten a shot, Amita St. Francis recently has been, they've always been a great partner of Evanston, but recently they have been helping our public health department administer the Pfizer shots. So residents have been going to Amita St. Francis to get those Pfizer shots. Sarah had a question on Facebook. Can I be confident, Ike, that my second dose will be available when I'm due to receive it in mid-March?
Absolutely. One of the things that the state has been consistent on is sending us the second doses. So if you receive the first doses, you can confidently know that you are going to get your second dose. And it has been, like I mentioned, on a consistent and steady basis. So that wouldn't be a problem there.
Yep. The state's been doing a really good job. I mean, again, I've sort of expressed some frustration in terms of us seeing an increase in the first dose allotments, which I don't feel like we're seeing a substantial increase that we were led to believe we should be seeing. But they've been doing a really good job of getting second doses. And again, reminder, if you're a Moderna and you're getting your second dose at 28 days or Pfizer at 21 days, remember CDC has been very clear that you could go 6 weeks after that date to get it. So I don't want anyone to think, oh man, it's the 21st day, I've got to get the vaccine. You could get it on the 25th or the 26th day. I think Evanston's been doing a pretty good job getting it around. What would you say, within what period of time? A week or two of somebody's due date for the second vaccine, Ike?
I would say between 2 days to about 5 days.
2 to 5 days of their due date, they were getting it. So that's a really good stat. Sarah also wanted to know she thinks you guys are doing a great job there in the public health department, Greg and Ike. Okay. Carol had a question on Facebook. Why can't, and this is a question that I'm getting a lot, and we're going to be putting some more information out. And Ike, I know you sent me an email this morning. I haven't had a chance to dive into it, but let's get into it now. Carol says, why can't Evanston residents register for the new county vaccination site in Des Plaines? The county site redirects me back to the city of Evanston site.
Right. So it's something that's is being sorted out between Cook County and the state. My understanding is that the vaccines allotted to Cook County is being used at these various sites. So I'm still waiting for information pertaining to whether Evanston residents would be able to access those sites. And if it's accessible by Evanston residents, which I'm being hopeful for, that will actually increase the number of people who can get vaccinated. But I'm still waiting for that confirmation from Cook County on the state or not.
All right, Carol, we are working on that. I've been speaking to folks about that as well. If we're not going to see a substantial increase in our supply of vaccines, then our residents ought to be able to attend a mass vac location in Cook County. Is how I feel, and I know our public health department feels that way. So we're going to continue to work on that. But thank you for that.
One thing, Mayor, the United Center is accessible to all Illinois residents. So if you're an Evanston resident, you can access the United Center by going online and filling out a form for registration. And at this time, they're accepting registrations for those who are 65 and older. And after they've substantially vaccinated those individuals, they will move to those who are in 1B, essential workers.
Great. Thank you for that, Ike. Again, right, that problem that we're experiencing, our residents are with Cook County mass vaccination sites does not apply to the United Center site. So definitely, if you are eligible in that phase 1B, please go online and apply to get the vaccination there. Jeff had a question on Facebook, and again, I've heard this question from lots of people who are under the age of 70 right now, but maybe in their mid or upper 60s. He says, "I'm 66. When can I expect to receive my first dose through the Evanston Health Department?" Greg, do you want to take this one and share with people where we are with our points of distribution, what age we're at right now?
Yeah, of course. So as we've been saying this whole time, our vaccine supply has been limited. So we were forced to prioritize who we gave it to within phase 1B. And so we prioritized the most vulnerable, the most older population, just because they're most vulnerable to effects of COVID-19. So right now we are at about age 69. We're below the 70s, so we are getting a lot closer to fully vaccinating the age 65 and up. And depending on our allocation from the state, we're given 3-week projections that, they're just projections. They can change, they can go up. I'm expecting them. I'm hopeful that they will go up with President Biden's announcement of every American getting vaccinated by the end of May. So I would think our supplies will be going up shortly, but we are close to working through all of the age 65 for residents for Evanston.
Do you have a sense, Ike or Greg, how many folks have submitted a contact form that are between the ages of 65 and 70? That may give people a feeling for, hey, there's 5,000 people in this cohort. And then maybe you could do some math and say, okay, man, that's about 1,000 for each age.
Yeah, and the last time we ran numbers, we were in the tune of about 4,000 individuals who fit that particular age group. But we also have to understand that most of those individuals, or a number of those individuals, have probably gotten vaccinated through other vaccination outlets. So that's where we stand, but we are hopeful that perhaps in the next 3 weeks or so, we should be down to 65, the age group of 65. We started, as Greg mentioned, with our oldest, who are the most fragile, and we've progressively work down in a descending order to those who are 70, 79 now. So it will just be a matter of time until we get to our oldest population, then we can move into other groups in 1B.
Great. So I just want to reiterate again, the City of Evanston's philosophy is, given the limited number of vaccines that we have been primarily focused on those that are most at risk of having severe complications should they get COVID-19. And the data is clear on that it is the older you are, the more severe your complications can be if you get it. So with the limited supply, we've been working down from oldest, down to 65. And as Greg and I just mentioned, we are right around the age of 69 right now for our events. So if you are, Jeff, 66, hopefully in a couple weeks, you will get a notice that you will be able to register. Again, I think we're looking at, as Greg mentioned, these are just projections we get from the state, but let's just say if we get around 3,000 or so vaccines over the next, 3 weeks or so, we should make a decent dent into that 65 to 70 age group. All right. Question from L. Will the city consider the vaccine brand when vaccinating certain groups? For instance, the less effective Johnson & Johnson vaccine could be provided to those at lower risk, and older populations could receive the Moderna or the Pfizer vaccines. Could you just talk to folks about the efficacy rate of these and whether that really should be something we're thinking about? Take us through that process.
Yeah, absolutely. If you analyze the vaccines we have, Moderna and Pfizer respectively have about 94 to 95% efficacy. The Johnson & Johnson does have a lower efficacy, but even with the lower efficacy of about 70 to 75%, it is a greater efficacy than our flu vaccines. So there is definitely some efficacy there. And when we are having these conversations of Johnson & Johnson, of course, when we start receiving them on who's going to receive it, we also want to apply equity. And at this point, we will get and receive any vaccine we can. But one of the things that we have made visible during our vaccination process is being transparent as to which vaccine people are getting. So if we get Johnson & Johnson, and we don't have any other vaccine, that's what that individual will be getting. We'll be making that clear to the individual. We have Johnson & Johnson. These are the only vaccines we have available. And if you agree, you will be administered this particular vaccine. But at this time, no one really has a choice as to what vaccine they are receiving. And if people want to opt out of receiving the Johnson & Johnson, we understand that. But they also have to keep in mind that if they opt out and we don't have any other vaccines to administer, it might take weeks and weeks before they get vaccinated.
Mm-hmm. I listen to a lot of public health experts talk about the different vaccines, and I was listening to The Daily today, which is a New York Times podcast. And, what I would share is that, we are, as a country, racing to get people vaccinated as quickly as possible. And we could argue about the methodology and how we're doing that, huge centers using existing healthcare infrastructure that we have and all that. But we are racing hard to get people vaccinated, in part because there are different variants now of COVID-19 that are out there. And, if you had a choice, even then it's hard to be strategic. Do I get the Pfizer? Do I get the Moderna? Do I get the Johnson & Johnson? Because, all of their effectiveness against the variants may differ as well. And so it's a tough analysis to do right now because, again, this is a novel virus. These vaccines are new. The good news is the vaccines are working. Just take Evanston, for example, all of our senior living facilities, we have not seen a case of COVID-19 with our seniors, many of whom had chose to be vaccinated, a high percentage. I think it was over 90% of seniors in our senior living communities were vaccinated, and we're not seeing any cases right now. So, and that's consistent with what's going on around the country. So right now, the effectiveness of these vaccines is mirroring the studies that were done. So that's really good news for all of us. Question from Michael. And this needs a real clear answer. I am over 65 but have not yet had the opportunity to be vaccinated. Can I be confident that the vaccine will be available to me if I wait my turn here in Evanston?
Absolutely. And as I mentioned, we are taking an approach of our oldest and working our way down in a, of course, descending order. And as I mentioned, now we're in the 70, 79 age ranges, and hopefully, if our projections are right, by the end of the month, and this is us being optimistic, that we should be vaccinating those who are 65, 66, 67, and older. So,
Great.
So yeah, but absolutely, we do it by turn, by age groups. So.
Thank you, Ike. We're going to turn to a couple of questions that are coming in on Facebook. Nancy asked the question, should residents remove themselves from the city's list if they've gotten the vaccine elsewhere? If so, how do we do that?
No, it's not something that I'm going to encourage at this time. If you received the notification to register for a vaccine, and if you've received it, just ignore the notification. I will rather do it in that fashion rather than people going in and
okay, so there's no need if you've gotten and I am encouraging people, go get the vaccine anywhere you can get it, but don't worry about if you completed the contact form here that you have to do something. Once you get a notice from us, you just say, nope, I don't need it, or don't respond, and the city will pass on the slot to the next person.
And also another thing that we've noticed is a large number of people share email addresses. So in the beginning, we made the decision to not remove email addresses of people who are already vaccinated, just in case these two individuals are eligible at different times. We didn't want to miss sending that initial person the registration link. So if you get it and you already got it, just disregard.
Thank you, Greg. Kathy and Barb asked, Indiana just opened up vaccinations to residents 60 years old and older. Why is Evanston moving so slowly? Let me just start off again. I think we've covered it a lot. We don't control the the quantity of vaccines that we get. That is dictated by the state, to us. And so we can only work with the vaccines that we have. And again, we described the philosophy that we're approaching, which is, seniors are getting the vast majority of these vaccinations right now, and we're working our way down. Anything else to add to that? But I can't explain. I don't know enough about what's going on in Indiana to know why they're at 60 and older. I can tell you every state's approaching it slightly differently. Some aren't doing necessarily a prioritization. Again, I wish we didn't have to do a prioritization. If we had enough vaccines, we wouldn't be doing that. But some states are just making the decision, hey, anyone can come and get the vaccine. But the state of Illinois hasn't really done that either.
Right.
Yeah, the only thing different I'd say that Illinois has done is they've actually added a phase 1B plus, which is individuals age 16 to 64 with certain medical conditions. The state said that those individuals qualify for a vaccine, but a lot of jurisdictions don't even have enough vaccine to work through 1B. So it all comes down to the number of vaccines that we have.
Okay, great. So that two other quick questions, and then we're going to move on to city vaccination plans and priorities. Question from Teresa: when will high school students 16 and older be able to get the vaccine? Any idea?
So for right now, those individuals will qualify for phase 2, or phase 1B part 2. If they have any medical conditions. But if they do not have any of the medical conditions highlighted by the recommendations provided, those individuals will be vaccinated when the general public gets vaccinated. So that's where we are. So phase 1B part 2 emphasizes or provides guidelines to who will receive the vaccine 16 to 64. with medical conditions ranging from obesity, pulmonary issues, cancer, heart disease, diabetes. So if those individuals fit in that particular group, then those individuals will be vaccinated. But if these individuals do not have those medical conditions, then it will have to be phase 2.
All right, thank you for that. And then one other question from Sarah: is it true that the J&J vaccine is very effective in preventing hospitalizations in severe COVID? Ike?
Absolutely, all vaccines are highly effective. The Pfizer, the Moderna, and of course the Johnson & Johnson that just got approved. And these vaccines, they go through rigorous reviews before they are given to the public. The same with Pfizer, the same with Moderna. So they do have efficacies. With Johnson & Johnson, it's a bit lower efficacy, but it's still effective in preventing hospitalizations and infections.
Okay. All right. Thank you, Ike. And keep the questions coming on Facebook. I think we've covered all of those now. We're going to move to other questions that were submitted beforehand. We're now moving to a section called City Vaccination Plan and Priorities. Joanne had the first question. Ike, as the Public Health Director, I'm sending this one your way. Why was the mayor, me, why was I vaccinated before residents in their 60s?
Absolutely. So I want to make this clear. I understand that there are a number of publications who publicize this information. So to make it clear, the mayor was not vaccinated because he's an elected official. The mayor was vaccinated because he has been part and parcel of our EOC, which is the Emergency Operations Center that we initiated at the beginning of this pandemic in order for us to respond to COVID-19. So as a member of EOC and as other members of the EOC, the Public Health Office decided that all members be vaccinated because their roles are deemed necessary in Evanston's response to COVID-19, vaccinations, and recovery. These individuals are very important in our operations. And like I mentioned, this is an EOC that was established at the beginning of the pandemic when we declared a local state of emergency, and these individuals have played integral and important roles in the way that we have fashioned our responses to COVID-19, vaccinations, and now that we're talking about recovery.
Yeah. Thank you, Ike. These are tough questions and decisions that have to be made, and they are decisions that sort of rest on our public health director's shoulders to have to make. But we see these kind of questions all the time, and that one happened to relate to me in my role in the Emergency Operations Center. But we see it all the time where people say, "Hey, why is some healthy 7-year-old getting vaccinated before me, and I have a comorbidity and I'm 50, but I'm at a higher risk?" And so difficult decisions. Again, at the end of the day, we want to get as many people vaccinated as quickly as possible. Robert had a question. I'll throw this to you, Greg. What percentage of vaccines are going to Evanston residents as opposed to people who just work in Evanston? So the rule is if you work or live in Evanston, you can be eligible to get vaccinated here.
Yeah, so we made that determination very early in the vaccine process, because even if you don't live in Evanston, you work here and you spend a good majority of your day as part of our community that can be at risk of spreading disease. So we want to make sure everyone in our community is vaccinated. So the percent of vaccines going to Evanston residents as opposed to non-residents. So we're working through our data right now. We recently put on our vaccine dashboard on the website. The majority of the data that's shown on there is information regarding people who we vaccinated at our pods, along with doses that we've distributed to our community partners. And we are working with the state of Illinois in order to get a better, larger picture of Evanston on a whole regarding people who have been vaccinated by us and our partners. So we're working on having that data shortly. The dashboard, it's not set in stone, so we'll be making updates as more and more data becomes available to us, because We know there's a lot of anxiety with vaccines, so we want to make sure that we're being as transparent as possible at what we're doing with them.
Thank you, Greg. So again, people can find the dashboard on the website if they just go to cityofevanston.org / vaccines.
Yes.
Yep.
And that's where they'll find it. Vaccine. Yep. Okay. All right. Next question from Nancy. Do you have to be a resident of Evanston to get a vaccine here?
Yes. Live or work in Evanston, and as Greg alluded to, it is a community effort for us to do the vaccination. So we consider people who do not live in Evanston but work in Evanston as our community members. So residents and those who live in Evanston both qualify to receive a vaccine at our parts.
Okay. All right. So you have to live here or work here, Nancy, to qualify for a vaccine here in Evanston. I mentioned the dashboard a second ago. We just got a question from Patricia. Based on the city's vaccine dashboard, so you go to it, why is there such a significant percentage of doses going to individuals under 65 years old? What's going on there?
So if you take a look at our dashboard, there is a significant portion of individuals who are not 65 and over who receive the vaccines. Those individuals are in a priority group that is ranked above or that is prioritized over those who are 65 and older, and those are healthcare providers. As you know, we do have a prioritization plan where it is structured in a way where priority is given to certain groups. So you have group 1A, phase 1A, phase 1B, and phase 1B part 2. So in phase 1A, you have our healthcare workers, those who are working in our healthcare facilities. So those individuals were vaccinated. And also, if you take a look at group 1B, where our 65 and older are categorized, you have our essential workers as well, who might not be 65 and older. You're talking about our police, you talk about firefighters and other essential workers. So that's why you see that significance there for the individuals who are not 65 and older, because they meet the requirements or the recommendations to get vaccinated prior to our 65 and older, or in conjunction with our 65 and older groups, because they're in the same group 1B as our 65 and older adults.
Okay. You and I looked at some stats, maybe it was a week ago, before the last city council meeting, because I wanted to know overall, removing all the healthcare workers that were in phase 1A and stuff, what percentage of the folks that were vaccinating are over the age of 65? And if I remember right, Ike, it was about 80%.
Well, if we dig through, you might be slightly wrong as we are digging through the data. As it stands, at our vaccination pod, we are close to about 50 to 55%. But also, if you factor in those who got administered the vaccine at a meter, then that percentage actually increases. But that is not reflected on our dashboard right now. What is being reflected are those who received the vaccine at our pod. And if you look at the dashboard on the far right side, you will see vaccines that were distributed. Those were vaccines that were given to our vaccine providers, our local hospitals to vaccinate.
So even the 900 or so that Pfizer that we gave Amita and told Amita who to vaccinate, which were over the 65 group, you're saying that doesn't show up on our dashboard. Okay, so it's hard. Again, yeah, I understand.
And
so
the vaccine that we gave was over 11. Well, they were able to vaccinate over 1,100.
1,100. Okay. All right. So again, we will continue to analyze the data and try to present it in the most helpful way as we can. Again, it's not super straightforward because of just like that example that I talked about. But we have a data team that's working on that. We'll try to get better. I think it's going to be a similar process to the way it was on the COVID-19 statistics, right? What we initially put out was pretty basic, and then we were able to get more and more sophisticated as time went on. And I hope the same thing can happen with vaccinations. All right, let's go to the next question. Can you provide information about the city's plans to vaccinate homebound individuals? Will those administering vaccines be equipped to treat allergic reactions?
Absolutely, I can take this one. So currently, the city is collecting information of 65-year-olds or older who are homebound due to medical conditions or mobility issues. So we've collected quite some substantial information, and currently we are in the planning phase. We're fine-tuning how we will deliver these services to those who are homebound who cannot attend any of our vaccination sites. And we are hopeful that in the next few weeks that we will actually implement that program by going to these individual homes and vaccinating those individuals. And of course, with us will be all the medical supplies, devices that we need in order, of course, to be successful in our vaccinations. And of course, professionals are going to be the ones delivering these vaccines, people who are trained to administer the vaccine. So there shouldn't be any worry, there shouldn't be any concern there. And as I said, we are fine-tuning that program so that we can efficiently and effectively deliver those vaccines to the people who need them at home.
All right.
And each staff individual that will be going out to administer the vaccines is going to be having a field kit with them that will allow them to treat and manage any sort of anaphylactic shock or allergic reactions while on site. And also it's a very rare thing to happen. For the Moderna vaccine, it's about 2.5 cases of an allergic reaction per every 1 million doses given. So it's very rare. But our vaccinators on site will be have the necessary supplies and medications should the event arise.
Thank you. Ike, question, nannies must be in contact with children and families. Are they considered an essential worker as part of phase 1B?
So nannies, unfortunately, are not mentioned in our priority plans. At least the state's priority plans, because our plans, of course, tailors that of the state. What they mention, of course, are daycare workers or those who are working in childcare centres. Those individuals are prioritised in 1B. But I will certainly like to get clarification from the state in that regard. But presumably, those individuals will have to fall into phase 2. But I would like to get an advice from the state so that they can clear that up a little. But
when you say phase 2, or do you mean phase 2 or phase 1C?
So there really isn't a phase 1C. That has kind of been removed. It's pretty much in draft at this time. They're working on it. So what the state did was move those individuals who were in 1C into phase 1B plus. I like to call it phase 1B plus. So these are individuals or those who are 16 to 64 who have medical conditions. So I mentioned phase 2 because after phase 1B plus, you're left with phase 2, and that's when the general public gets vaccinated. But I would like to get clarification where nannies who are not affiliated with daycare centers or other childcare providers, where they fit in these categories. But as it stands, they have not been indicated to fall into any category.
Ike, let's talk educators. Got a couple questions here. Robert asked, why is the city vaccinating some teachers who are younger and teaching remotely before individuals 65 to 70? So why don't you talk about, educators, early childhood providers, and how the city's approaching that group?
So the way the city is approaching is that we are vaccinating those who are providing in-person classes or activities or sessions to our children, to our young individuals. So when it comes to those whom we are vaccinating, I'm not aware of anyone who's in their 30s who got vaccinated who's not part of those who are working in person. And not just that, the way that we fashion this is to vaccinate those who are the oldest first. So the ones who are the oldest providing in-class, in-person activities are being vaccinated first, and we're working in that order. They get vaccinated first, then we move to the next age group in a descending order. So that's how we have implemented that program. So we do have an event for teachers come tomorrow. We've been able to vaccinate the oldest of the group. So right now we're about 50, I'll say 50, those who are 50 years of age, and we're going to be vaccinating. So that's the order in which we have been working on, just to make sure that the process is fair. That's the approach that we've actually taken, vaccinating our teachers. So
Okay.
from the all the way to.
All right. And again, because you have limited supplies, it's a relatively small apportionment of the doses that you get that you set aside for educators, which include early childhood teachers. And you're looking at those that are only right now in the classroom, and
Yes.
you're starting with the oldest and going down. Okay.
Absolutely.
Question from Lemon. Are teachers who live in Evanston but work outside of Evanston eligible to receive the vaccine?
The short answer is yes.
Okay.
Because they are Evanston residents, so they do qualify to get a vaccine.
And I know like there are a lot of questions, not only from teachers, but from parents about, is there a time limit when teachers will be vaccinated? I mean, there was, people are pretty excited about the news yesterday where President Biden said that, they're looking to get all teachers vaccinated by the end of the month, I believe, by the end of March. People have emailed you, I know, and they've emailed me. And, my response to people has been totally supportive of this objective and this goal. I haven't seen sort of the implementation plan for how that's possible because, again, if we could get our hands on additional vaccines, then we can help, achieve that goal. But right now, again, the quantities that we're receiving here are pretty, are not significant enough.
Right, absolutely. I think you hit the nail right on its head, Mayor. If we get thousands of vaccines, of course, the teachers are going to be vaccinated. But because we're receiving limited vaccines, we have to approach it based on, from an exposure standpoint, those who are reporting to work in person, to get those individuals vaccinated first. Then we can start vaccinating, of course, those who are working from home or working remotely. But we are being optimistic, as I continue to mention, that vaccines will increase, hopefully over the course of maybe April, late March or so. And that's us being optimistic, and individuals who are interested in the vaccine will definitely be vaccinated. But we are prioritizing those who, based on an exposure index, or more prone to COVID infections, and we'll continue to move down the line.
Do you know if somebody gets a vaccination, they're in phase 1B and they get a vaccination at a pharmacy, are the pharmacies prioritizing like, no, we're only doing, we're working with the oldest folks who would be more susceptible to severe complications, or are they saying, hey, we just want proof that you're in 1B? So if you're a teacher, you're a plumber, you work at a grocery store, they'll give you the shot if you can get a appointment.
So my understanding is that most pharmacies are pretty much focused on those who are 65 and older. Then after they've substantially been vaccinated, then they can move to those essential workers or others in 1B. I honestly think that that's the way to go, given that our 65-year-old and older, they are most vulnerable to COVID-19, to get those individuals vaccinated first before moving down the line. And as we continue to reiterate, that's how we fashioned our vaccination effort to vaccinate those who are oldest and move down the line. But the pharmacies, from my understanding, is if you're 65 and older, I don't think there really is a prioritization to get those who are the oldest first. I think it is first come, first served. If you're able to prove that you were 65 and older, you would get the vaccine.
Okay, thank you, Ike. All right, we're going to move now to I've got some questions here on 1C, and I feel like we're far from 1C. So just for me to recap, 1C no longer exists. All right, so folks understand that the state is redoing sort of its approach, prioritization. They've eliminated 1C. There will be
there will be some recommendations in the near future of what 1C is comprised of, but for right now, it's currently in draft. What we have is 1B Part 2.
Okay, so I'm going to revisit. We had several questions about 1C. We're going to revisit that at the next coronavirus Q&A when hopefully the state has come out and we have more information on sort of phase 2 and who's in that group, and we'll share that information. I want to go now to city vaccination events and registration. What is the city's protocol for distributing vaccines left over due to no-shows? How does that work?
So at our pods, towards the end of the day, once our last appointment is wrapping up, usually 3 or so hours before, we start meticulously opening vials only as needed. And this is in order to ensure that we are left at the end of the day with the least amount of doses possible. But if we do have 1 or 2 doses that are left over to use, we have a list of individuals who meet the requirement for that day's event. So we would reach out to them. So it's that's basically our priority, is to focus the extra doses on individuals who would qualify for that day's pod event. But throughout our pods, from the beginning to the one tomorrow, the one a few days ago, we've gotten a lot better at making sure that we do not have leftover doses at the end of the day. We've gotten just very thorough in how we're handling those leftovers.
Good. So we're not wasting shots here, because I know there are people in this town that would show up in 5 minutes notice to get a shot, Greg. Thank you. Thank you.
Last thing we want to do is waste any shots.
All right. Virginia asked, what happens if I miss the email inviting me to register for my second dose?
If they missed that email, they can let us know by emailing vaccines@cityofevanston.org. Then we can register that individual for the next time we'll have an event.
Thank you, Ike. So vaccines@cityofevanston.org is manned by a group within the public health department. They've really been a huge help, because we've been aldermen, city manager, others have been getting lots of emails. We just forward them on to vaccines at City of Evanston. So if you're listening to this and you have a question and you missed an appointment or whatever, just send an email directly to vaccines@cityofevanston.org, and they should get back to you. And if you keep sending and for some reason you're not hearing back, you can email me at Steve Shaggerty, 1G, at cityofevanston.com. All right.
And then if I could say something really quick about the second doses. I've noticed there's a lot of anxiety about the second dose. And just wanted to make it clear that if you receive a first dose from us, you're guaranteed to get a second dose. And when we send the registration link, we only send it out to the individuals who were at the first pod getting their first dose. So it's not something where we're sending out to thousands of people. It's only number of people who needed that second dose. So there's no sort of sense of urgency or rush to stay on your email or anything like that. You will be contacted at the off chance that you aren't. Reach out to 311 or vaccines@cityofevanston.org.
Thank you, Greg. Emma asked, Ike, maybe you could explain your thought process, because I know you guys have thought a lot about this. She said, can Evanston set up a drive-through vaccine site, Or I would ask, have you thought about that? And if you decided not to, can you just explain the thought process for our residents?
No, we thought about it. We didn't think that it would be feasible at this time of the year because of the weather. But it's a conversation that we've had amongst ourselves, the planning team, to have a vaccination pod, the same way we set up COVID testing and flu vaccinations outdoors. So we think there is a possibility of having that when the weather improves. So we'll continue to work on that process. And of course, that information will be disseminated to the public on how those vaccines pods will be set up. But it's part of our ongoing conversations regarding outdoor vaccination sites.
I know more people haven't been vaccinated than have been vaccinated, but for those that have been vaccinated, I can't tell you how many emails the city has received, that are overwhelmingly, effusively supportive of the process that the city has set up at the community center, how efficient it is, and the good customer service and everything else. So, I know many people are anxious to get their vaccines. My expectation is that you'll have the same good experience that folks who've already been vaccinated have had at the city's point of distribution. You guys have really done a nice job, so thank you on behalf of everyone. Let's move to vaccine and health questions here as we get close to wrapping up. If the vaccine is 94% effective, and again, the effective rate varies for some of these, but if it's 94% effective, will the 6% of individuals for whom it was not effective experience less severe cases if they contract COVID-19? Mike?
So the experts are learning as we continue on this journey of vaccinations, as they continue to analyze the effectiveness and the efficacy of vaccines. And of course, it is information that will be relayed to us after they conduct these analysis and reviews of, the 6% that this individual mentioned, and even the 95% efficacy. So studies are on the way to fully understand what it means in preventing COVID-19 infections and the efficacy and what have you, and how long the immunity from these vaccines are. So it's something that is being studied, it's something that is constantly being reviewed, and we're hopeful that this information will be relayed to us as to these other questions people have regarding the vaccine and how long and what the immunity is and how far and how long that goes. So as information reaches us, of course, we'll be relaying that to the general public.
Thank you, Ike. Greg, Joseph and Karen had a question. Is it safe to fly after receiving both vaccine doses? And if not, when would it be safe to travel?
So the recommendation now is after we get vaccinated to still wear face coverings, still social distance, still watch your hand hygiene. So you can travel, but you still need to be taking those safety precautions. Until a large percentage of the population has been vaccinated, I have a feeling that we'll be wearing face coverings and social distancing for a little while longer, even after we've been vaccinated, just to ensure.
Right. But what's the period of time till you have sort of full immunity? I thought I read something that it's pretty much like 10 or 14 days after your second dose. Is that correct?
Yeah, it's correct. Yep. About 10 to 14 days, yes.
So 10 to 14 days after your second dose is when you should have the full immunity to it. And again, all the public health protocols still apply. And again, the reason for that isn't that if you get it, there's a heightened risk that you're going to have like some severe complication because you've got the antibodies, you've been vaccinated. What they don't know, and they're studying right now, is whether you could still somehow transfer the virus even though you've been vaccinated. Sure. And so that's the studies that are going on right now. And as time goes on, we'll learn more about that. And that will impact, the protocols that we have around masks. Holly had a question. Will people need to show proof of being vaccinated in order to enter public buildings or airplanes or anything like that?
Right now, I can speak to public buildings. There's no policy or guideline that bars a person from entering public buildings. You also have to understand vaccines are strongly encouraged, but they are not mandated. So no one will stop you from entering a public building if you're wearing your mask and abiding by the preventative strategies and protocols. No one will stop you, but there's in no one's policy or guideline in regards to entering a public building.
Okay, thank you, Ike. Greg, are there any, Debbie's asking this question, are there any concerns with infertility related to the vaccines?
No, not that I've been made aware of. There's no, I know studies after studies are being conducted currently now on the vaccine and its effects short-term and long-term. But as of now, there's no effects or anything in regard to infertility.
Do you know when pregnant women will be able to get the vaccine?
Well, as a matter of fact, they are, you want to say that?
Go ahead.
Okay. As a matter of fact, they're actually included in phase 1B plus, 1B part 2 to receive the vaccine because the benefits, according to experts, outweigh the risk. But if someone is considering getting the vaccine while pregnant, our advice will be for that individual to consult with their healthcare provider so that that individual can be adequately informed. So that's our recommendation about people who are pregnant. But they are included in 1B plus to get the vaccine.
Okay. Esther had a question, and I think we'll wrap up with this, and then I'll make a few comments at the end. She says, I've had both vaccine doses. When can I begin meeting with friends who have also received the vaccine? I hear this from a lot of people. We're anxious to, socialize again and all of that. And I know people are talking, saying, "Oh, well, you have been vaccinated? I've been vaccinated." So, what does this mean for people?
Right. Reviews and analysis of the vaccine they're still on the way. We are obtaining information as we go along during our vaccination efforts and periods. And this goes back to, I believe, one of the questions about 6% efficacy, 95% efficacy. So in situations like this, because studies are still underway, experts are still learning about the efficacy of the vaccine. And what has been encouraged is for people who are fully vaccinated to continue following preventative protocols, wearing your mask when you're within 6 feet of individuals, social distancing, washing your hands, avoiding large crowds. So this is probably going to be the norm until this pandemic is adequately and substantially controlled. So if you're fully vaccinated, there is no guarantee that you can't still pass the virus. So that's why it's encouraged for people to continue to practice those public health measures to prevent any type of transmission.
All right, Ike, but Esther could probably get together with her friends who have also been vaccinated. You're saying, hey, still practice social distancing, wear a mask, and good hygiene, and avoid Esther, avoid going to meet with a dozen people or something like that. But she could. Okay, because I know there are lots of grandparents that are being vaccinated as well, and yearn to see their grandkids and others and children who they haven't seen for a long time.
Absolutely.
I want to thank both of you, Ike Ogbo, our Public Health Director, Greg Olson, our Operations Chief and Deputy Public Health Director, for spending a little over an hour with us today, answering many questions that I have, that our residents have about vaccinations. In particular, we will continue to keep our community informed with the latest information that we have. And I want to end by encouraging everyone. If you are in phase 1B, I want you not only to submit the contact form, which I imagine you already have with the city of Evanston, recognize that as we continue to plead our case and try to get more quantities of vaccine here in Evanston to, submit a registration and try to get to the United Center and get your vaccination there. That is open to anyone as long as you're eligible in the phase 1B group to try to get in with the pharmacies that have it as well, and to continue to be patient and sort of understand that this is a massive undertaking by every level of government, from our federal government to our state government to our county and to our city, and we will continue to try and get better at this and more coordinated, and also be patient with our hospitals. We have a great healthcare system here in Evanston and on the North Shore, and I can tell you the frustration I expressed today, or I did, just wishing that we had more quantities of vaccine. Our hospitals and our healthcare providers feel the same way. And I know many people have registered through those systems, and they're saying, hey, why hasn't North Shore called me back and scheduled my appointment? And again, they are struggling with vaccines. We are working together. I'm working with the presidents of the hospitals to sort of make our case. And I feel strongly about direct allocations to our healthcare institutions as well. So we are all in this together. I appreciate everybody's, patience and adaptability, and for tuning in. We will hold another one of these in a couple weeks. Lastly, a big thank you to Patrick Degnan, our Chief Information Officer, who helps coordinate this and also sends out the Thursday e-news that goes out to tens of thousands of people. If you're not registered, go on the city website and register for that. We always have an update on vaccinations and the COVID-19 pandemic. So thank you, everyone. Be well. And remember, we still have to keep wearing our masks. Bye, everyone.